Yo guys, what's up? Welcome back to my channel. It's your boy Hillman here. For those of you who are new to the channel, welcome. I'm back in another video, guys. And for those of you who know, who may not know as well, I am a fifth year medical student and I'm currently doing my clinical rotations. And at the moment, I'm actually doing psychiatry, right? So I'm doing my psychiatric rotation at the HIC. So the HIC is the high intensive care, basically the intensive care unit before psychiatry. Just picture this. Picture what you see in the movies when you think of the psych ward. Picture, all the really intense psychiatric cases. That's where I am now. That's the department I'm working at. So, needless to say, that has been one of the most. I'm actually not done. So I just finished the 5th week now, and I'm going to the 6th week, which is the last week. Needless to say, this has been one of the most mentally and emotionally taxing rotations, and I'm going to tell you guys why in a bit. But I've had rotations like surgery and internal medicine, and those were just heavy. They were heavy, but this one was like emotionally, mentally, and spiritually taxing. It was just, anyways, we'll get into that in a bit. But basically, this video I'm going to be chatting about what it is like rotating at a high intensive care unit for psychiatry, because some people have been asking me, what is that like? What do you do? What kind of patients do you see? And all that kind of stuff. So I'm going to be breaking that down in this video, talking more about that. And then just a general update on what is going on, where I am, what am I doing in my life and stuff like that. A lot of things have been happening. So I felt like it was high time I update you guys about that, because people have been asking me as well. One or two people have been asking me. And then big updates. There's big updates coming, guys. Life is happening. Life is just lifing. And we're here for it. So I'm going to be telling you guys more of some of the big updates. If you want to definitely know what those updates are, if at all you're interested, then definitely stick around to the end of the video and then you will know more about that. But without further ado, let's jump right into this video. So, the HIC, the High Intensive Care for Psychiatry. Guys, I heard a lot of stories about it. So before I went to that department, I talked to a couple of friends who have been there as well. I asked them what it's like rotating there, what can I expect, how are the psychiatrists, and all this kind of thing, just to get a picture of it, right? And some told me, in their own words, it's Nollywood, it's a movie sometimes, it's quite intense, it's quite hectic. So it's like, okay, it's definitely something, right? So I already had some sort of expectation pattern before I went there. I went there knowing fully well what to expect, but after a week or two, I noticed I was getting sucked into the department. I was getting sucked into the flow. I was on high alert because, yeah, things happen there. The kind of patients we see are, for example, patients with like heavy psychosis, like patients who have hallucinations, who are seeing things, who are hearing voices, who are really in their own world. Basically, the reality is really augmented, so they are not in the same reality as we are now. So you have a patient who is like talking to you and it's like, yeah, there's 15,000 law students looking at him and telling him what to do and paying attention to him and stuff like that. And of course, these hallucinations, you study them, but still to be confronted with these patients for me was like, oh wow, this is interesting. And one thing I found very, very surprising while on the department was how normal some psychotic patients look, right? Because for me, I don't know about you, but for me, when I thought about psychosis and psychotic patients, I always imagined zombies. Basically, people just living in zombie land, walking around, basically crazy, like mentally all over the place. Like you could not have a conversation with them. But I was surprised, right? These are people who are in and of themselves they look like normal people. If you don't talk to them, you rarely know anything is happening, right? But if you talk to them, you tend to figure out that, okay, there is more going on there than what meets the eye. There is no coherence in the speech. The stuff that they're saying does not sound realistic. All these kind of things where okay, there's over exaggerations in some places, there's delusions in a lot of places. People think they are God. Okay, you could think that, but we think differently about that. We have to differ with you on that and stuff like that. Whereas, like, if you don't talk to them, you can rarely think that something is wrong with them, right? Which was far from what I thought before I started my psychiatric rotation, where I was like, okay, if people are psychotic, you would see them from a distance and know they're psychotic, they're crazy, they're running all over the place barefoot and threatening people's lives and stuff like that. And it's worth mentioning those people are there as well, but I was surprised by the fact that there's also people with whom you just can't see it from the outside. So I was like, okay, that's actually quite interesting. Another thing I found interesting actually was just I think that's so yeah, I don't know if I liked it or I don't know how I felt about that exactly. It was how open the patients were at some point. Like the limitations are just they were just all down. Like, normal societal constructs, which maybe it's just social cues where you're like, okay, this is something which is not fitting to say in this situation. This is something which I can say in this situation. Just the social cues you get. I feel like all of that was just lost. People were just saying anything. For example, I had a patient who was walking around the department with me because he asked me if I could walk out with him through the wards, and I was walking with him because it's a closed department, so you cannot just leave as a patient unless someone goes with you or unless you've taken permission. So I went out with him, and we're walking across the ward. He was like really psychotic at that point, having all these delusions and hallucinations, and also manic. But he went throughout the department, throughout the ward. He was telling everyone his African doctor. He said he's my African doctor. He's my Ebola doctor. I was like, wait, what? At that point, you're in this strange dilemma where it's like, okay, you're psychotic. That's true. So this is not necessarily you talking. But then again, on the other hand, I always ask myself, where do all these psychotic thoughts and experiences and realities come from? Do they come from nowhere, or are they a reflection, a reproduction of your subconscious, which maybe did not feel like they had the freedom to be expressed before? I think that's a question which I might not have an answer to, I might never get an answer to. I asked a psychiatrist the same question as well, but he just couldn't give me an answer to that because it's something which science hasn't gotten clear yet. But I think it's interesting sometimes to just see what patients come with when they're in their whole psychotic experience. That was something that definitely stood out to me because the limitations were just all gone, guys. The things people were saying there, it's almost comparable for me. It almost felt like going to a bar, like a student party, and everyone is just on alcohol and everyone is just saying what they think. Oh, that's fun. Those are fun experiences, if you know what I mean. But yeah, it was just interesting. That I found that really, really interesting. Something else I also found interesting was how much medications patients were pumped with, right? So for example, I always pictured psychiatry as talking, as trying to figure out what's wrong with the patient, and then having cognitive behavioral therapy and stuff like that, all the psychotherapy and all that kind of stuff. I really did not know medication played that big of a role in the psychiatry world, but I was surprised because at the high intensive care, it's all about medication. It's mostly about medications. But then again, that was because I did not understand what the high intensive care unit was actually, because they're basically there to tackle crisis situations. So if you're in a crisis, they're sent to the high intensive care and that's tackled there. They're not there to deal with things which are not emergencies. They're mostly for psychiatric emergencies. So then that means they have to use the most effective means they have to tackle the crisis at the moment. Because after the crisis is resolved, you can go on to the next department where they can take care of you and follow you up. And most of the time, medication is the best way to deal with a crisis. And medications work faster most of the time as well compared to other conservative methods of treatment. So I guess that's something I did not know in the beginning, what the function of the HIC was. I just knew the HIC as a psychiatry unit. But when I got to get the explanations and I got to get clarifications about it, I understood, okay, the HIC is where you manage crisis, and most of the time crisis is managed bestly with medications, because these patients, you cannot talk with them sometimes because they are so in their own realities, in their own worlds. So I eventually got it. But in the beginning, it was just something which was surprising me. I was like, interesting. Yeah, guys, but this has really been, I just cannot describe how enriching this experience has been. It's been emotionally, mentally, spiritually draining, like I said. But then again, I leave and go home because I have a difficulty with switching off, especially when it's situations like this. I cannot stop thinking about the patients, right? And that's where the difficulty came in for me, because I get so involved with the patient situations, and I'm like, okay, how can I help them? What can I do to help? How did they get there? Trying to ask these questions, which sometimes you may not be able to get an answer to, but somehow I just felt like there must have been a reason why they got here. And this could be my brother, this could be my family member, this could be my sister. And also added to the fact that a lot of the patients there are also patients with a migration background. So it's like, okay, this is even more confronting for me. So how I have to think about how they got there. And all these things like stay with me even after work, right? But then the funny thing is, the interesting thing I find is the fact that I still feel motivated to go back the next day. So I love the department, I love the colleagues, I love the environment, I love the exposure, I love being able to see this part of society which an average person would not see, an average classmate of mine would not see as well, because not everyone goes to this department during the psychiatric rotations. It's really enriching for me, but it's just the fact that, okay, how do I cope with just being so involved with the patients and everything. For example, right, there's just some stories that just stick with me. There's a 40-year-old guy, gets psychotic, comes to us, and towards the end of his treatment plan, we invite him for a discussion, for a consultation, just a regular checkup. How he's doing, how's everything going. He starts crying. He starts crying because his dad gave him a hug, like a real hug, like a proper hug after 40 years. This guy tried to compensate, try to get accepted by people by building muscles and making himself look better and stuff like that, when one of the main things he wanted in life was just a proper hug from his dad. And he finally got that in a mental institution. And that was just, 40-year-old guy just started crying like a baby there. And it was just, for me, it's just like this kind of things, these small things really, they stick with me. I'm like, sometimes what are we as a society actually doing? Like how society is all evolving and stuff. And I live in the Netherlands, one of the richest countries in Europe, where it's like standards of living are really high. But how are we doing with regards to mental health? How is society helping promote better mental health? In what direction are we heading? Because these are questions where I'm really like, okay, I think if we really need to think about this, because it's not like something extraordinary happened to these patients to get them to where they are now, like the high intensive care, but it's just regular things which could happen to any other person as well. I think that for me was really confronting. One of the most intense moments for me, for sure, so far for this rotation was when I had to inject a patient under duress, so like by force. So he was basically restrained, and I had to like inject him. I've seen that being done before in Ghana, but I didn't expect to see that here, right? I mean, I hear it a lot that it's done, but I didn't expect to see it. And talking to the fact that I was the one who was giving the injection, it was quite confronting. But I think that was definitely an experience I would never forget. But all in all, it's been a really interesting experience. I think it's intense, it's draining, but you learn a lot from it. And I think I'm so blessed that I could be exposed to this kind of patients, because I think it just helps me realize what I have more, be more grateful about stuff, be more aware of stuff like that, and also just care for people more, ask people questions, just do the small things which people will not normally get from other places, because everyone is so busy with the individualistic flow of life here in Europe and stuff like that. So I think it gives me another perspective which I really value and appreciate, and I'm definitely going to take that forward for the rest of my career and for the rest of my life. So that it's been a great experience at the HIC, at the high intensive care. I'm at week 5 now, so I'm done week 5, going to the last week now, week 6, and then after that I have a 2-week break. Guys, I need a mental break. I need a vacation, so I'm going on a vacation for 2 weeks. After that, I have my GP rotation and my social medicine rotation. So I made a video about pediatrics rotation for those of you who have not checked out the vlogs at the pediatric department. Check that out. So I've had pediatrics as well. I've had ophthalmology. I've had neurology rotation as well. That was one of my best, because I'm also I'm passionate about neurology. So I've had those rotations already, and now it's left social medicine, GP, and then 4 other rotations, which are mostly elective. So I'm trying to organize something. And one of the big updates is related to that, because I might or might not be relocating out of Maastricht, temporarily or for good. But I guess that's something which I'm going to talk more about in a next video. I'm going to dive deeper into that in the next video. But basically, the big update is my time in Maastricht might be coming to a close. And I know a lot of you from YouTube have reached out to me because you're coming to Maastricht and you want to meet and hang out and just chat and stuff like that. Hopefully we'll get the time for that, because I think I'm still going to be here at least the first month of the next academic year, so September 2022. So hopefully we can meet up, chat, catch up and stuff like that. But yeah, just know I might be leaving Maastricht soon. I think it's sad on the one hand, because I feel like I'm getting I'm getting, like, Maastricht is becoming my place, my city and everything. I can find my way around. I can get what I need in the city really easily. But I think it's also, I think it's time I make a switch, a change of environment, because I think I'm getting comfortable in Maastricht, and I don't like getting comfortable. I need something to challenge me. I need something to get me curious about the environment, get me, you know, the curiosity needs to stay there. And I feel like the curiosity is dampening every day in Maastricht because I'm just comfortable. It's my city. It's just, I've been here for 5 years, guys. 5 years is a long time. But anyways, the big update is I might or might not be leaving Maastricht soon, temporarily or for good. More details about that, I'll definitely update you guys on that along the way. When it gets closer to that period, if it's sure, if things are certain, I'll let you know exactly what the plan is. And of course, for those of you who are subscribed, you can follow me, because I'm not gonna stop making videos. I'm gonna be making videos. So anywhere I go to, any updates I have, any changes that happen in my life, you would be the first to know, because I think I'm trying to post more videos on here than on Instagram. But yeah, guys, interesting things are happening. I don't even know what. I feel like I need to make a separate video about just updates, because everything cannot fit in this video, with the coaching, with setting up new associations in the Netherlands, with health, gym goals, with traveling goals. Guys, it's a lot is happening, but it's all really exciting. And then the prospect for the next 2-3 years, I don't try to think about that too much, but once in a while I think about it, I'm like, ooh, looking spicy. So it's all really exciting. I'm in good health. I'm grateful. I'm thankful for that. Yeah, guys, I think I'm gonna keep this video short. I'm gonna leave it at this point. I'm gonna make a separate video about updates and any other stuff you want to know. If you want to know anything else, if you have any questions, curiosities, let me know in the comment section. I'll be sure to make a video about that. I'll try to not make this video too long, but I see it's already really long. So guys, until next time, hope you all have a great day. Enjoy your summer and stay blessed. Peace.